Vamos a empezar precisamente con Darek Richards. Come with me, Darek. Voy a hacer la introducción en español. La verdad es que with such a long CV, Darek, don't imagine that I could keep all in my mind. Darek es director científico principal de Silver Cloud Health e investigador principal en eMental Health Group en el Trinity College en Dublín. Darek es doctor en psicología precisamente por el Trinity College, además de promover su grupo de investigación, como comentaba, que se centra en el desarrollo e implementación de soluciones digitales para la mejora de salud y el bienestar, donde actualmente además bueno, pues, trabaja en su día a día, pero además es asesor científico, director científico principal de la startup Silver Cloud Health, una empresa tecnológica reconocida mundialmente que provee soluciones terapéuticas online para mejorar el comportamiento y el bienestar mental. Esta empresa, para que se hagan una idea, ha tratado ya a más de 80.000 pacientes en todo el mundo. Se utiliza por más de 120 organizaciones en Europa y en Norteamérica y actualmente está en aplicación en el UK National Health Service. Ha tenido un crecimiento exponencial en los últimos 2 años y, por darles el último dato sobre esta startup, este mismo año ha anunciado una inversión de 8,1 millones de dólares, una serie A liderada pues, por un fondo en el que participa Eduardo Severin, uno de los cofundadores de Facebook, más famoso por la película, yo creo que la red social, que por liderar también este fondo, pero es una de las cosas que podemos aprender hoy de Darek Richards. Darek, welcome.
Gracias.
Thank you very much for your participation. Welcome, very warmly.
Thank you very much.
The stage is yours.
I have to keep an eye on this. Thank you very much for a warm introduction. I'm happy to be here. It was difficult to know who I was coming to see, whether it was an academic audience or an industry audience or an innovation audience. But it seems it's quite a mix, and that's nice, actually. That's the best type there is. I want to try and tell a little bit of a story, and I'll start broad and go narrow. But a lot of this may be familiar to you. But what I'm going to try to do is dig a little bit under the surface of what we know in terms of healthcare and the possibility for technology-enabled healthcare. To do that, I want to start with smart healthcare. This is a relatively recent concept in some ways and how we understand it. From that, I want to extrapolate out the idea of this need for a leap. And I suppose some of us here have started on that leap. There are many and countless examples of innovations that have begun that leap and are advancing the idea of technology-enabled healthcare. I want to talk a little bit about the market, simply because I was asked to. It's not my area of expertise outside of my involvement with SilverCloud and running a business, but I will talk a little bit about it. And then I want to talk specifically about SilverCloud and some of our own experiences and some of our own successes. To begin with, the idea of smart health care or technology-enabled care. A recent report highlighted quality, outcomes and value as the cornerstones on which healthcare needs to be delivered. This is nothing new. They're talking about this for decades. In fact, we know in most countries that the spend on healthcare is phenomenal. And in most countries, you have a differential between the budget and the cost. In the NHS in England, that differential is 20 billion currently, and it's only going to expand. That is exactly the same across the globe, at least in the Western societies. And when you consider that, or even in the US where you're talking in the trillions of dollars, that's a significant portion of GDP. And it's unsustainable. It's simply unsustainable. So as a result, what healthcare is looking for are innovative, digitally enhanced, cost-effective, patient-centered innovations and answers to the problem. The question is, can we deliver? Can it be delivered? Is it a possibility? Is it a real possibility? But let's break it down a little bit and let's start to think about what smart health actually means. What are the core attributes of this concept? Some of the core attributes, at least in my mind, would include the following. That you're delivering treatments to people on time and on demand. There's no extensive waiting lists which incur and only leverage or only produce chronicity in disease and its management. But when it's on time and on demand, everyone benefits from the early intervention. It will have to involve the entire healthcare practitioners to leverage technology to diagnose and deliver care. They can't do it by themselves in any field of medicine or psychological science or other distinct areas. If you doubled or tripled the human resource capacity, you still won't have enough in the Western world presently to meet the growing and ever-growing demand of morbidity, multimorbidities. We have to use information effectively and centrally stored, and that includes the patient health record and its interoperability and shareability. And that's key for across an ecosystem that wants to understand what's happening and deliver care effectively and make effective decisions. Patient data obviously included in this. An interesting one is correct individuals doing correct work. This is going to be a big challenge going forward, I believe, in healthcare. And not just the right individuals doing the right job and the associated competencies, but actually also the workflow practices changing and being rearranged almost to suit the need of a digitally enabled healthcare system. Now, I'll say more about that later because it's quite an enormous task. Patients will have to be involved in their care, centrally involved in their care. No longer can we have the paradigm of the healthcare system and the patients and the power imbalance. That has to change. Contextually, obviously, I'm talking about Western society principally, because we're an aging demographic, multi-morbidities, long-term conditions. The cost of those is escalating year on year. We need to expand the reach into populations that are currently underserved or not served at all in our population in order to be smart in our healthcare delivery. And ultimately, we improve efficiency and we reduce waste. These are all probably well known to most of you, perhaps. These are ideas that we talk about continually. But these are also where we haven't got to yet and we want to get to. It's a massive amount that needs to happen in order for us to get there, and there are some significant challenges to actually getting there, some of which will include these. Cost is obviously one issue. I just mentioned a moment ago, the cost of healthcare delivery as a proportion of GDP is enormous. It's unsustainable. No healthcare system, no nation state in the world can sustain this. And I'm particularly talking again about Western society, first world developed countries, because of the aging demographic, because of the multimorbidities and the chronicity involved. We have to move from volume to value. This is a massive challenge, because before you had the revolving door, basically. Take a simple example of, I'll go to my GP and I'll continually go and he will get paid. Now you have a move to, well, actually, you know what? Here's a pot of money now. That pot of money is all you're getting to look after this patient. And you have to perform on the metrics of quality and standards and still meet the needs of the patient within the pot of money. So that's a significant shift from volume to value-based care. And that will drive the market, and that will drive the models, the business models in the market in terms of value delivering value-based care. Health policy and regulation. Policy is a continual effort across healthcare systems. But what I think a part in this will be regulation. regulation is only going to increase. If we consider the idea of, at least even try to consider the idea of a technology-enabled healthcare system or ecosystem, that will have to be regulated. We'll be very familiar with the regulations that are in place for biological interventions. We'll be very familiar with regulations in place for technical innovation or intervention, such as a pacemaker, and they're highly regulated industries. There's already signs of digital care moving in that direction, and I'll give some examples later. But this is something going to challenge companies in the space very much, because they're going to demand certain levels of companies before they are approved for use within a healthcare system. So regulation is going to be something of great importance. We have to find exponential technologies. And these are the ones that will answer the three key drivers of quality, outcomes, and costs. Exponential technology is essentially where, year on year, the technology's capacity to manage and deliver expands. Conversely, of course, the cost decreases. This is Moore's law. It's only an historical law. That's what it is. It's about the prediction of history. But that is what we are actually seeking. Now, I'll say more about that specifically as I go on, because that's a key differentiator between technologies that are coming out of laboratories and saying, no, this is a brilliant idea. Of course it's going to work. And then suddenly, oh, wait, no, it's not working. And then suddenly you go further and you realize why it's not working. Maybe it's due to scalability. Maybe it's due to it can't deliver on a return on investment or other issues. The patients will have to be central in this, along with the healthcare providers, obviously. But we have to start listening more to their needs and what they will and will not use, and what they will not just use once or twice, but continually use. And that's of even more importance in the society we live in, because it's not like, if I characterize it by an example, someone might, in the area of psychology, someone might have an episode of depression and you deliver an intervention that's a brief, focused intervention, and you move them outside a diagnostic criteria for the episode. But then if someone has diabetes, well, that's not episodic, that's long-term. And now if you want to use technology to try and help with the management of it, now, you can't just think once off. You have to think continual use. How do you actually overcome that challenge? How do you increase stickiness? How do you do that? Shaping the workforce of the future, I think, is going to be something that we'll see happen in healthcare. It has to happen in healthcare. And this is about growing efficiencies and have people doing only the job they're supposed to be doing within the competencies. So that, for example, nurses are doing nursing and not administration at a simple level. But this could really be revolutionary. I mean, if you walk into any organization and you propose a change management strategy for the entire workforce, you're going to get a few people's backs up. So that has to be done carefully. But there are examples that it has been done already, and I can tell you some of those. So the idea of us arriving at smart healthcare is a great idea. Conceptually wonderful. We need to get there. The bottom line demands we get there. But it's complicated. It's extremely complicated. And I suppose what's possibly required to articulate it is something of a digital leap. A digital healthcare leap. The health sector in the coming years, and even now, it's doing it now, but in the coming years at a grander scale, will need to be able to leverage technology to fundamentally reinvent the system. Now, that's a big ask of digital, but it's not being asked out of ignorance. It's actually been asked quite intelligently and based on a lot of evidence that shows that actually it can be done. It can actually do this. A second point here, which I think is an interesting one to even consider or reflect on in all of our work, is, digital healthcare is not about principally about the technologies we use, or the evolution of those technologies, or the new ones to come, or It's actually about the problems being presented. And often, again, an example of this is like you have, you have software engineers building a lovely app location for something. But because it has been built solely in an ecosystem of developers, it's missing a bit. It's missing a real understanding of what problem it's actually addressing, and therefore it fails. I've seen countless numbers of this scenario being played out, where apps developed to meet an apparent problem in healthcare have failed. It calls for interdisciplinary work for certain, and we need to work together across the disciplines to arrive at the best solutions. Here's a diagram that captures something of that leap. And it's a simplified version of it, I have to admit, but it's really the historical movement from a basic healthcare paper and pencil system right through something of what we have now will be captured in the middle one, especially in the Western society. That middle one. We're very siloed. There's a lack of interoperability. There's a lack of information sharing. Patient health information is siloed in one place. It's difficult to access across an ecosystem. These are all barriers that we mentioned to get into smart care, technology-enabled care. And unless we can overcome them, we're not going to get there. And the challenge in our healthcare systems is because we have so many legacy systems that don't talk to one another. Even at that technical level, it's a challenge. But where we want to get to is a new model of a cloud-based, open source, mobile and social integrated. That's happening in some parts of the world. There's some key examples of it. And interestingly, and this might be surprising, but there seems to be more traction in the developing world than in the developed. And one of the principal reasons for that is because of our own legacy systems that are kind of in place, have been in place, and are difficult to actually change. Making that transition, and I'm not saying we're at the very beginning, we're not. There's a lot of good stuff happening in this space to move us closer and closer to technology-enabled or smart healthcare. But it will involve disruption. And I don't just mean technological disruption, I mean disruption in business models. We need new business models to be able to manage this interoperable, cloud-based, open source model of healthcare, for example. It has to be patient-centric, and it has to enable and leverage interaction between the healthcare providers and patients in a far more meaningful way than we do today. Far more meaningful way. That if we can't do that, we will not get adoption and we will not get continued use. Definite. If there's a disconnect there, it has to be integrated rather than siloed, independent, and lack of interoperability. And we have to move from issues around data protection, privacy, security, to trust. So these are major challenges in our move towards a technology-enabled healthcare. And all of these can be broken into multiple other parts, some of which I'll go on to describe. But in terms of the landscape for industry, or small and medium-sized enterprises, or new enterprises, here's a couple of points. The companies that will actually do well in terms of digital companies for healthcare, that they're able to very clearly articulate how they add value, very clearly able to articulate how they align with incentives within and throughout a healthcare system. They can analyze data fast. Now, that's not an easy thing to do because you need to understand what data you have in order to build insights. And those insights should propagate back in to inform the next evolution. That's a huge one. I see that even with Silver Cloud. At this point, after X years in business, we're at a point where we're getting big data insights. And it's actually, wait now, what data do we actually have before we generate the insights? the digital companies that are going to be transformative and acceptable will have to really know what the providers and the consumers value, and then meet that value. They will have to be able to develop the insights from data and quickly. They'll have to address and understand and meet the challenge of adoption and continued use, the stickiness factor. And they may have to reinvent a workforce or reinvent workflows within a system so that the technology can be an enabling factor. These are massive challenges. As I move through, hopefully these become even more concrete as I give some examples from practice. But look, we're talking conceptually about smart healthcare, technology-enabled care. We see these problems as massive challenges, but we can get there, and there's good evidence for us to get there. This is what it might look like, actually, in a diagram, where you have the member or patient, and you'll see all the way they're connected in and with an integrated care team, but you still have your bricks and mortar. That's still there. That's not going to go away. It's just going to hopefully reduce. And within that, I mean, that's the ideal scenario to get to, but we're incrementally moving along the path. And actually, at a global level, there is significant work being done. I pulled up a couple of companies here. I did include SilverCloud in it. But the reason I put those companies here, just as disparate examples, is because I didn't want to articulate these companies necessarily, or what they were principally doing. What I wanted to articulate or show is that it's vast. Each of these companies is working in digital space at a different point in the care pathway of patients or in the healthcare ecosystem. These are only some examples. I could have populated 10 slides with these. And actually, only this morning I was talking to someone here, Trip Doctor, could be another one up there. But if you look at them, you have Patients Like Me. It's a platform for research where patients become actively involved in research trials, but also they share their data in the community around their own conditions. And the ultimate aim is for better self-management of long-term conditions. They also share that data with GPs. That's at that point in the care continuum. Coordinate My Care there on the bottom right. This one. This is in the end-of-life scenario in palliative care, where now this application is allowing for the first time, possibly, individuals to actually plan how they're going to die, plan the way they want things to be organized, and that's shared seamlessly across their healthcare providers. You have Total Mobile there, again, a simple, for a mobile workforce, this is in England, where they're out and about visiting, they're doing visitations to homes. And they now have at their hand on tablet form a broad range of apps providing information, some diagnostics, some screening, and all fed back into a mainframe for two-way communication. That's reduced time spent and cost. Oh, by the way, each of these I have up here. Two things are important about these, and there are many more besides. This is very limited. They operate on different points along the care pathway, demonstrating that there are multiple opportunities for digital to go into healthcare. Two, all of these have already a substantial body of evidence produced and published. Not necessarily peer-reviewed academic evidence only, in some cases there are, but just real-world data that are showing quality maintained, outcomes being delivered, and value reductions in cost. So these are some of the ones that are contributing. Another example is this is the more enterprise example, Philips, digital hospital, basically. You'll see all of this is coming in waves of transformation. This isn't going to be click fingers, yep, being it's all done. It's going to be waves of transformation. This is just a kind of a more enterprise example that Philips have done in terms of engaging enterprise technology across the care spectrum at different points in care. And I don't need to go into the exact detail of all of this. This is publicly available. You can look it up in terms of its detail. The point essentially is we have a massive challenge to get to smart healthcare, digitally enabled care, technology enabled care. We have massive challenges, but they can be overcome, and there are really lots of opportunities across the care continuum, across the ecosystem of healthcare. Briefly, in terms of the market, in the last decade, the interest from the healthcare industry's interest in digital applications has grown exponentially. It's not likely to change. Going back to the initial observation, technology has to be transformative. There's a vision that it can be transformative, really leverage and change the dynamic of the overspend, the burden, and especially in the Western world where the picture of healthcare is not getting brighter. In terms of the market, the estimated value of the market this year is 21.5 billion. This is compound interest growth year on year. So it's phenomenal, exponential growth in the market, which is interesting. In terms of the greatest investment, here's a top 15 produced recently in a report of countries that are actually investing in digital healthcare. I mean, on the left-hand side here are some three important characteristics. An active market size, that the population is big enough, that there is access to investment, of different types of investment, and there's an acceptance by healthcare professionals and the patients of the use of digital. So these are only three of the requirements that drive the market in digital health. And Spain is in the list there at number 14. So these are the top 15 currently. In terms of the segments or market segments, you have obviously the companies, digital health companies that are, the innovation coming out of industry, coming out of academia, the innovation coming out of different laboratories. You obviously have pharma, hospital, and health insurance. Pharma, hospital, and health insurance are driving this in lots of ways because they have such a key interest in healthcare and the health care of the people they care for. Also, the bottom line here is cost as well. Ultimately, it's cost, but it's also more than that. It's also about providing better care. Ultimately, we have to have an aim to provide better care for more. Interestingly, at the top here, you see some of the major developments have been in the area of some of the long-term conditions are mentioned here. Telemedicine, also in behavioral or mental health. Now, that's not surprising, because these are the key drivers in healthcare in terms of costs. Long-term conditions, as I referred to earlier, is massive in the Western world. We're an aging demographic, we have morbidity and multimorbidity, and we have comorbidity with psychological disorder. Behavioral health alongside a long-term condition increase the cost of care for that patient 3 to 4 times greater. It's massive. So that's just a picture, and a brief picture. I mean, again, this is as much as I feel comfortable saying on this. I can talk more about this later if anyone is more interested, especially in relation to the drivers that mental health incur with long-term conditions. But have a look at this. The number of app publishers are only increasing, but the number of downloads are decreasing. So, are we backing a losing horse when most apps don't get downloaded more than 5,000 times and only 2% have a usage of 500,000 on a regular basis? Problem. Major problem. How can we reconcile the ideas I've been presenting earlier? No, we need to do a technology-enabled healthcare, and this. What's the problem? Looking at this a little bit closer, we find the following picture being prepared. I want to separate wellness management and health condition management. Wellness management includes the lifestyle, stress management, fitness, feedback loops at a lifestyle level. Health condition management is about information on diseases and conditions, their management and self-management, and interventions. Empirical or empirically based interventions, evidence-based medicine. There is a difference between these two, and actually the graph earlier speaks more to the first. That what we have in the market presently is a proliferation of tracking, wellness, apps, but a lowering of the demand for them. Whereas in healthcare, we have actually increased attention being paid to condition management applications and their relevance in care. Now that's key. To illustrate that further, the top 5 health condition management are the following. Mental health conditions, up there, number 1. Diabetes, cardiovascular diseases, nervous and musculoskeletal. This is not surprising once again. These are the major issues in healthcare. These are the cost drivers in healthcare, the long-term conditions and behavioral and mental health. It's not as surprising they're up there. So, across our ecosystem of what we can be engaging by way of digital applications, and there are multiple, telemedicine, smartphone, biosensors, web-based programs, text, email, messaging, etc. We have lots of opportunity across these to engage sensibly and intelligently in developing applications that can address core problems in disease management and health condition management. And included in that, I will include in that, prevention and maintenance. However, a really worthy note to reflect at this point is, let's not start rushing into our laboratories and building or buying. What we do need to consider is evidence. Healthcare system is not going to spin on a whim. Oh, it looks great, I love it. Let's roll it out. No. Increasingly, and this goes back to some of the issues I mentioned earlier around regulation and policy. Increasingly, they're going to look for, no. It looks great. You're telling me it does what it says on the tin, prove it. Regulatory bodies will also require that, as they do of industries, established industries such as pharma, such as tech industries, health tech. At the moment in the world literature, academic literature, for health condition management, there's sufficient empirical knowledge and a base to support the inclusion of digital health apps, some in diabetes management, depression management, and anxiety management. That's why SilverCloud, for example, has been adopted so widely, or one of the reasons. It's really important that we generate evidence and we have good, solid evidence. Across that spectrum, I could have populated that. We don't have time in terms of other disease areas, other conditions, other aspects of healthcare. And this is just, I'm focusing down now into condition management. Obviously, within that last slide, we're also talking about efficiencies in system, which I'm not dwelling on today. That's another day's work. Okay. So, lastly, and I'm 1 minute over time. Is it okay if I take 2 or 3 more minutes? Thank you. I just want to briefly talk to you about SilverCloud. SilverCloud occupies this area, web-based interactive platform and programs. So, we consider ourselves as a mental health and chronic disease platform, offering highly engaging interventions across mental health and long-term condition management. And these are delivered on time and on demand. They're designed well, they're evidence-based, we have the trials to prove it, and we deliver the equivalent of face-to-face care. If I was to deliver a psychological intervention of the same magnitude face-to-face, I would expect to see the same results. That's a slide on our history, going back many, many years when we had more basic technology like websites or post-nuke open source software, and pulling these together experimentally and delivering them out to try. And my motivation at the time was, we need to actually extend reach. The mental health services are crumbling. We progressed on through a National Digital Research Institute, where translational research in 2012 we spun out, and we've done massive amounts of work since that time, and we've grown exponentially. We've grown exponentially. Exponential technology is what will succeed, among other characteristics. At the moment, actually, it's 200,000 patients, and we achieved that last month, and that's across a number of countries and a diverse array of healthcare systems, pharma, charity, NGO, etc., and multiple languages. One of our biggest markets is the NHS. I'll briefly say something about the NHS without going into too much detail. The NHS is quite progressive in terms of a market. And they're a good test bed and a good ground for innovation. And they allow for that. And we've done well in it. But also, at a regulatory level in England, there is regulation around digital health apps. NICE, the National Institute for Clinical Care Excellence, regulate. And I was only on a call last week with NICE where they're going to another step of regulation. This is going to be what will happen. And a core part of the regulatory requirement will be evidence to show that it works, how it works, its adoptability, its usability, its continued use, its patient satisfaction, healthcare provider satisfaction also needs to be met. There were some slides around outcomes. I'll skip. But is it all about having a good digital intervention? You've created something amazing. Yeah, no, it scales. Oh, no, it returns on investment, definitely. Oh, no, it drives value, no problem. And, oh, outcomes, yeah, on point. It's not enough to have an excellent digital intervention. And what we've learned at SilverCloud, in order to be able to do this well, you need to consider a whole ecosystem approach. From service development, implementation science and how you implement, training an entire ecosystem of what this is, how it works, how it should be done, and all different levels within it, from your procurement to the clinicians, to the providers, to the management, etc. Comms across an organization, continued evaluation and feedback of insights, technology, being developed, continue to be developed using insights from on the ground, and content improved and design alongside it. I could say a lot more about this because this is something we've done a lot of work on, but I'm conscious of time. I'll leave you with one end note, which is this. I started actually at the beginning, I said something about this, which is, I find this fascinating. Globally, in the Western world, we have major problems. We have massive costs, and we're looking for solutions. We believe technology-enabled care can deliver. I do believe it can too, and there's countless examples to proof of point. In emerging markets, interestingly, by 2030, you're going to have the highest middle class. The populations are only increasing. The demand for healthcare is going to be enormous. And key, they do not have some of the legacy systems and thinking that we have. So therefore, you have examples currently across emerging markets of real innovation. The Philippines, for example, the whole country, the government side, we need a patient health record. Oh yeah, we'll use open source, being done. That wouldn't happen here in Spain, I don't think, or in Ireland, or in America. That's only one example of actually quite a number at the moment, but it's an interesting thought to end with. Thank you very much.
Muchas gracias, Derek. Yo creo que aunque me salte un poquito el programa, tendríamos tiempo para una pregunta, una sola pregunta, aunque recuerden que luego tenemos el network, si alguien se anima. La verdad es que me da un poco de pena que no podamos hacer preguntas a Derek. Derek, one last question. You mentioned in your presentation, what about mass adoption, right? There are problems with digital e-commerce, there are problems with digital fintech, what about adoption? How much time do we need to get to this point till our children are older?
It's a very good question, adoption. I mean, what I was proposing in the talk is these are massive questions that we need to address and find answers to. Actually, if you look around the world, and there was one slide with some companies on it, there's actually a broad plethora of companies actually making changes in digital healthcare space already. They're having an impact. They're having an impact on outcomes, on the value, on the drivers, and they are making changes. In one of the slides that I didn't show you was a qualification of, I'll just roll back while I talk to it, in terms of access, outcomes and cost. In IAPT, the NHS National Health System, they see 1.2 million per year. They've reduced waiting list to 6 weeks by demand. Outcomes are on a par with any other psychological or biological intervention, and the cost has been reduced. These are the type of metrics that are going to drive adoption, but they take time. Only talking earlier about people involved in clinical trialing, we need to establish that phase first, then what's next, then what's next. There are stages. It takes time. Obviously, like for SilverCloud, for example, you mentioned at the start we raised 8.1 million a year or so ago, which we were very glad of. But we had been working at an academic level since the early 2000s. We had progressed through translational and into commercial in 2012. So we accelerated quite fast, but we had some of the key attributes to make us an exponential technology, and then we had to prove it out at a small level and now later at a massive level. The time scale is difficult to know, but it is happening. There's many countless examples of it happening, and also in very niche areas as well, which can be surprising. But also, looking at some successes, and even SilverCloud as an example, it can happen, and it is happening at scale, for certain, adoption at scale.
Okay. Thank you very much. A very interesting presentation. Thank you very much.